Hi, my name is Dr. Ronak Patel, and I'm a board-certified orthopedic surgeon specializing in sports medicine and complex knee injuries. In this video, I'm going to talk to you a little bit about ACL injuries and what other pathology is typically found after an acute ACL injury. So patients will typically have a 40% chance of having a meniscus tear during an acute ACL injury. The lateral meniscus is more commonly found to be torn in an acute injury, but medial meniscus tears are not uncommon. The menisci, if you remember, are cushions that provide a bit of shock absorption in the knee. And there's a medial or inside and a lateral outside meniscus. Both of these can be torn during an ACL injury. And subsequently, if an ACL injury is untreated chronically or after a few months, a medial meniscus tear becomes more common or prevalent after the acute injury. Why? Well, the medial meniscus is the secondary stabilizer after the ACL. So if in an ACL deficient knee, the medial meniscus, particularly the posterior horn or the back of the meniscus, starts taking more of the energy and shock absorption. And subsequently, repetitive microtrauma will lead to tearing of the medial meniscus. So we see more lateral meniscus tears in the setting of an acute ACL injury, but in a chronic or more ACL deficient knee, we will see medial meniscus tears. But both can be common or present in or after any ACL injury. It is important for your surgeon and the treating physician to repair or restore those meniscus surfaces. The meniscus, a meniscus, whether it's the medial or lateral, is very sensitive tissue, and we want to repair and preserve those meniscus tears if possible. So during all my ACL surgeries, we will do what we call a diagnostic arthroscopy and fully probe the medial and lateral menisci to make sure that there's no tear, because even if the MRI does not show one, there's still a chance that the intraoperative findings will demonstrate a meniscus tear. If a meniscus tear is found during an ACL surgery, we will repair it, meaning we will suture it and preserve it in order to preserve the shock absorption protection of the meniscus for the joint. That helps prevent arthritis long term. Particularly important is to know that a meniscus repair has higher healing rates during an ACL reconstruction compared to a meniscus tear without an ACL reconstruction done concomitantly. Why? We believe that the blood flow from the tunnels allows for greater cytokines and growth factors to embed into the repair site and help the meniscus biologically heal. Subsequently, we are motivated as surgeons to repair the meniscus when possible. So we have a saying in the knee preservation world, which is save the meniscus. So if you have a concomitant meniscus injury with your ACL tear, make sure your surgeon repairs and sutures that meniscus. Don't let your surgeon say, we'll see what happens when we get in there. Make sure they are motivated to repair it and preserve it for your long-term benefit. Thanks.